Welcome back. Our medical panel is here providing you with a second opinion on your health questions. And now we'll hear from Patricia. Hi, Patricia.
Hi. I have a question about falling. I'm 76. I had quite a severe fall a few years ago. And initially I seemed to be all right, and then I couldn't walk. And then I went in and had surgery, rehabilitation, now I can walk. But I have this fear of falling, and I can't go down subway steps. I have to go down sideways. It's not because I probably can't, but I have that fear. So I'm looking for something that is going to give me some program, something that's going to give me a little more confidence. And what should I be looking for so that I don't fall again?
Excellent question. So that there's many answers to that, but I'm going to start by saying this is normal. This is normal, and a lot of patients report this after a fall and after a fall that had consequences. It can be very, very scary to go back to the things you used to do without that fear of falling. We have to look at why did you fall in the first place, and what are some of your risks of falling again. So that's strength, that's eyesight, that's sensation, that's balance, that's all of these things that we have to put into the recipe that is preventing falls so that that doesn't happen again. So there are fall prevention programs and classes in community centers. I think many hospitals offer them as well. But a physiotherapist can help identify what your fall risk is and what you need to work on to help prevent the falls, which in turn is going to build confidence so that you feel you can take the subway steps or go down the stairs or bend over and pick something up.
Therapists, psychologists, psychotherapists, I know there's so many different terms that we throw around for these types of people who help us with our phobias, our fears, developing that confidence. If you are lucky enough to have coverage for a good quality psychotherapist, they would really be able to help you build that confidence and internal strength along with your physical therapist, chiropractors, and your health team to get you feeling more comfortable doing that. Therapy, we all need it. We are all a little bit anxious. We all have fears. It's natural, it's human, especially as we are aging, especially after a trauma. Just talk to your doctor about it.
Frankly, ever since COVID, I have not seen my doctor in 4 years.
Oh my goodness, it
Oh
might
my
be tough.
I'm thinking of making an appointment. Thank you.
Let's get to another video question. This comes from Henry.
Hi, I'm Henry from Toronto, and I've recently been noticing pain in the backs of both of my heels, which feels to me like it could be Achilles tendonitis or something like that. What's the most common cause of that kind of pain, and how can it be easily alleviated?
When we have pain on both sides, we have to pay attention to where the pain is and where the pain may be coming from. So it's important to evaluate this pain by the family physician in order to find out if there is any inflammation happening, if there is any stretch, has there been any falls, and has there been any traumas, or the problem is coming from somewhere else, like from the back. All the nerves that innervate the leg, they come from the back. And if there is any problem in the back, they can cause problem where they go, including the back of the heels and Achilles tendon area.
Some quick fixes though, change your footwear.
Yes,
change your
huge.
footwear, change your footwear, change your footwear. And then some of the basics of anti-inflammatory protocol, right? So use ice, if you can take an anti-inflammatory, this is not medical advice, but you can do that. And that repetitive, typically if it's an Achilles tendonitis, there's probably some sort of repetitive action, whether it's a running or mostly running a lot of the time, to take yourself out of that for a short period of time to see if we can decrease that inflammation.
What about, what are those things called?
Orthotics?
Orthotics, yeah.
Orthotics change the way your foot sits. So is there something that we can work on before we go to a third party, we'll call it, to support the joint? Sometimes orthotics are necessary depending on the joint, if there's a fallen joint, if there's flat feet, if someone has to wear a type of footwear for their profession, dancers, runners. But often, I don't know what my colleagues would say, but I would go see if there's intrinsic changes, strengthening changes, footwear changes before we go to a custom-made orthotic that probably will be required in every piece of footwear you wear.
Okay. We have an email from Raj. He writes, I'm 71. I'm urinating about 10 times a day. My doctor said I have nothing to worry about, but could this be a sign of a bigger issue? I am talking about prostate cancer. What other signs should I look out for? Dr. Moore.
Okay, so you know when you went to a concert in your 20s and there's a big lineup on the women's bathroom and the men's bathroom is wide open.
Everywhere there's a big line on the women's side, yes.
Anyways, when you go to see a Rolling Stone concert now where the audience is 60 and 70, you see a humongous lineup on the men's side and it's open on the women. And that's because frequent urination is typically associated with an enlarging prostate, which unfortunately is part of aging. So that's a very common condition. Prostate cancer is also quite a common condition. But looking for prostate cancer, really, you need to do things like PSA testing and digital rectal examinations. Frequency in urination of itself is probably more just a sign of what we call BPH, or benign prostatic hypertrophy, which sadly is, as men age, we all get it.
Okay, we'll be right back with more of the Zoomer.